Can genetic markers predict osteoporosis risk before symptoms? Imagine knowing your risk for osteoporosis long before any signs show up. That's what genetic markers can potentially do. They help identify people who are more likely to develop low bone density or fractures based on their genes. Scientists have discovered hundreds of regions in our DNA linked to osteoporosis risk. These genetic clues can be used to create tools called polygenic risk scores. These scores combine many small genetic effects to estimate how likely someone is to develop osteoporosis in the future. Osteoporosis happens when bones become weak and fragile, increasing the chance of fractures. Usually, doctors diagnose it after a fracture or when bone density tests show low bone mass. But genetics play a big role in bone health, with heritability estimates between 50 and 85%. That means your genes can influence your bone strength quite a lot. Recent research has found nearly 900 genetic regions associated with low bone density. These discoveries help scientists develop models that predict who might be at higher risk even before symptoms appear. For example, people with high genetic risk scores may have up to a 17 times greater chance of developing osteoporosis compared to those with lower scores. Some advanced models combine genetic information with factors like age, sex, and lifestyle habits. These models can predict osteoporosis risk with good accuracy, sometimes with an area under the curve of around 0.8. This means they are fairly reliable in identifying individuals who might benefit from early prevention. Using genetic screening early could be very helpful. If someone in their 20s or 30s finds out they are at higher risk, they could start taking steps to protect their bones. This might include ensuring enough vitamin D and calcium, engaging in weight-bearing exercises, and making healthy lifestyle choices. The goal is to prevent bone loss and fractures before they happen. However, it's important to remember that genetics are just part of the story. Environmental factors like diet, physical activity, and hormonal health also influence bone strength. Genetic testing is not yet a standalone diagnosis but a tool to help guide early intervention. It should always be used alongside traditional assessments like bone density scans and medical advice from healthcare professionals. In conclusion, genetic markers do hold promise for predicting osteoporosis risk before symptoms appear. They can help identify who might benefit from early prevention strategies. But this approach is still evolving, and ongoing research continues to improve its accuracy. Always consult your healthcare provider for personalized advice and to understand your individual risk factors.